STI Testing History: How Views Shaped Availability. Imagine a world where knowing your sexual health status was almost impossible. Over centuries, our understanding and attitudes towards sexually transmitted infections have dramatically changed how we access testing today. From ancient civilizations like Egypt, Greece, and Rome, people recognized STIs but had little idea how to diagnose or treat them. Early treatments were often toxic, using substances like mercury or arsenic, which did little to cure infections and often caused harm. It wasn't until the early 20th century that real progress began. In 1910, salvarsan was discovered as the first effective treatment for syphilis, a major STI. This breakthrough shifted the focus from just treating symptoms to actively diagnosing and managing infections. The real turning point came in the 1940s and 1950s with the advent of antibiotics like penicillin. These medications made bacterial STIs like syphilis and gonorrhea curable, which encouraged public health efforts to promote testing and treatment programs. During the 1960s and 1970s, diagnostic methods improved further, and governments started establishing STD clinics. Contact tracing became a key strategy, where testing and treating sexual partners helped control the spread. However, even with these advances, many people still felt ashamed or stigmatized, which kept some from seeking testing. The emergence of viral STIs such as genital herpes and HIV/AIDS in the 1980s changed everything. HIV/AIDS, with its long asymptomatic period and serious health effects, made it clear that early detection was crucial. Public health campaigns ramped up, emphasizing the importance of testing after exposure to prevent transmission. Blood tests for HIV and herpes became more accessible, and guidelines for testing were established to encourage people to get tested regularly. The 1990s brought technological advances like nucleic acid amplification tests, which made testing more sensitive, faster, and easier. These innovations increased the availability of testing services and helped monitor antibiotic resistance, especially for gonorrhea. Societal attitudes also played a big role. Stigma and shame around STIs often made people hesitant to get tested, especially in communities where discussing sexual health was taboo. Over time, public health efforts focused on reducing stigma, promoting routine testing as part of overall sexual health, and ensuring confidentiality to make testing more acceptable and accessible. Today, testing after exposure is seen as a vital part of staying healthy. It allows for early diagnosis, timely treatment, and helps prevent the spread of infections. The history of STI testing shows how medical advances, societal views, and public health priorities have shaped what's available now. It's important to remember that testing is a key tool in protecting your health, and consulting a healthcare professional can help determine the best approach for your individual needs.